series. I'd like to welcome you to this first session of 3 webinars delivered in partnership with the Race Equality Network and the West Yorkshire Health and Care Partnership. Over 600 people stop working every day in the UK to provide care for a family member, neighbour, friend, or a loved one. 1 in 7 people are working carers, and around 400,000 people are unpaid carers that are living in West Yorkshire. Many not identifying themselves as such, and all have an invaluable role supporting those needing care 365 days a year. Nationally, unpaid carers save the economy £132 billion per year. The West Yorkshire Healthcare Partnership Unpaid Carers Programme is committed to supporting and recognising unpaid working carers living or working within its 5 local places, including Bradford and Craven District, Leeds, Kirklees, Calderdale and Wakefield. Evidence shows that many unpaid carers across the West Yorkshire Healthcare Partnership's workforce face a multitude of challenges because of both caring and being from an ethnic minority background. All organisations that form the West Yorkshire Healthcare Partnership want their health and care system to be a supportive environment where they fully understand the needs of its diverse workforce. Today's webinar is titled Working Carers in a Local Authority Setting, which will open up a discussion around the challenges and inequalities, as well as understanding how managers can best support their staff through the Working Carers Passport. Today, we will be hearing from our amazing panel, Tony Sheekey, who is the lead for the Bradford Council Staff Working Carers Network. Tony will be providing an overview of the carers agenda and the support that Bradford Council provide and offer to its working carers. We will also hear from Khalda Ashrafi from Bradford Council, Javad Nizami from Leeds City Council, and Shaheen Khosa from West Yorkshire Healthcare Partnership, who have kindly offered to share their personal lived experiences on how they balance their work life whilst providing unpaid care for a loved one. Please note that this session is recorded and will be used for training purposes only. There will be a poll shown in the chat, which I will encourage everyone to complete. This poll will be used for evaluating outcomes of these online webinars. There will be opportunities throughout the session for you to ask our panel questions directly and via the chat box. So please use the chat box if you have any questions. I would now like to introduce our first guest, Tony Sheekey, who will give us an overview of the carers agenda. Thank you.
Good morning, everyone. As I've been introduced, I'm Tony Sheekey. I'm the carers lead for Bradford Council's commissioning team. Not only do I jointly sit as chair for the Working Carers Support Group, which is a staff-based carers support group in Bradford Council, I commission services on behalf of the council for carers support. So essentially, I was asked to set the scene in terms of carers passports in general and support that Bradford Council are providing, or Bradford in general is providing for working carers. So essentially, a carer's passport comes in different formats, and it can be for people who are working carers, but it can equally be for people who engage with services at the point of contact with services. So I'll focus mostly on working carers, but I think it's important to set the tone that carer's passport can come in different formats depending upon where it's applied and who it's aimed at. So in most cases, the working carer's passport is essentially a conversation. It's a conversation between the individual staff member and their employer to discuss the support that the employer might be able to offer that individual to combine their role as a working carer and as a member of the staff team. And it's trying to help them balance their roles as a carer and as a member of the staff team. And as I say, essentially, it's a conversation between the individual staff member and their manager is the way that the working carers passport is formatted within organisations. In Bradford, locally, we have a number of different organisations who have adopted working carers passport practice within their organisations. Within NHS Bradford District Care Foundation Trust, they've introduced a staff working carers passport, which they have developed to support their own staff induction processes, their ongoing policies for staff support. Within NHS Bradford Training Hospitals Foundation Trust, they've introduced a separate carers passport, which is aimed at people as at the point of contact with services. So that's for carers who are not staff members, but are carers themselves, and it's aimed at supporting them as they engage with services, looking after the cared for person that they are caring for. So that gives you the balance of the main two different forms of carers passport: working carers passport for staff members and for service users at the point of engagement with services. In terms of the council, the council, as I say, the council have a number of staff network groups, established a number of staff network groups where staff can meet together as peer support groups to discuss the issues that they might have in relationship to their role within the council and as a member of a particular peer support group. In terms of carers, working carers within the council, we established a group which we call Working Carers Support Group. The group created its own name from that staff network and decided that the name itself should show what the group's about. So essentially, it is a self-support group for working carers within the council, and it provides them with a forum to discuss the issues that they might have as members of Bradford Council and as working carers, trying to balance, as I say, trying to balance the role of being a carer and a full-time member of staff at the council. So it meets once a month, or roughly once a month, where people have the opportunity to discuss anything that they want to do as part of an open forum drop-in session. So they don't have to attend every month, to just drop in whenever they want if there's an issue that they want to talk about. We usually have a guest speaker at the beginning of each session so that we have a theme to each session, and it's essentially an open forum meeting. Outside of the working carers support group, what we have done is developed a paper which we are taking through corporate processes to ask for the introduction of carer awareness training within staff induction processes. We feel it's important that most staff within the council are made aware of the issues that carers face as working carers, and we're talking about that training, that carer awareness training, to be developed as both staff and management awareness raising. And that at the moment is as far as we have gone in terms of moving towards developing a working carers passport within the council. We haven't actually adopted that at the moment because, like most and support the staff, Bradford Council already have a large number of policies in place that support staff, flexible working and all those kinds of arrangements, which you do expect to find within a large organisation like the council. So most of the policies that you would expect to see within a carer-friendly organisation are already in place with the council. So much of the work has already been done in terms of developing a working carer passport environment, it's already there. I think that the main thing that the Working Carer Support Group feel is necessary now is to roll that out more with an awareness raising campaign, rather than the need to change council policies. It's more about developing the awareness of carers and highlighting their role within the council. As I say, the Working Carers Passport, within general terms, not just within the council, is essentially a conversation and a person's, a staff member's annual appraisal stroke review. It should be, and potentially it should be something that the carer could ask for to be reviewed at any time should their circumstances change. NHS Clinical Commissioning Group have already introduced a similar scheme within their organisation. So they basically looked at the requirements of introducing the Working Carers Passport and have adopted some parts of that as it is appropriate to their organisation, and introduced carer awareness training as basically obligatory parts of their staff induction and annual training cycle. So they have an online training portal, which is similar to the council, and there's a unit within that which is about working carers within the CCG. So I think we'd like to move towards something similar to that within Bradford Council. So at the moment, we're currently taking that up through the appropriate channels as an awareness raising campaign. Speaking for myself, personal experience, I can say that I have been a carer for my father in the past, so I do know what is faced with the difficulties sometimes of balancing your working role with your caring role outside work. And at that point, I think that's as much as I would want to say at this point, and say that, you know, that within Bradford, various organisations, the NHS and the council and the CCG, are at different stages of adopting working carer passport practices.
Okay, thank you, Tony. That was really insightful, and it's such fantastic work that organisations across the district are doing to implement the Working Carers Passport to support those staff members that are working and also caring for a loved one at the same time, which can obviously be challenging. Does anybody have any questions for Tony before we bring the next speaker on? Please feel free to use the chat box as well as we go along. If you want to put your hands up, if anybody has any questions. Tony, I've got a question. So do you know, with the Working Carers Passport, do you,
Yes.
are staff allowed to take time off if they've got appointments for a loved one? I mean, because usually when, you know, you have an appointment, if I have an appointment for my child, you know, I've always had to take time off, but does that compensate the employer then?
Essentially, that's one of the, I mean, I'd say there's a generic format of Working Carer Passport. Carers UK website has information on the different ways to implement a Working Carers Passport within different types of organisations. You might be a school, it might be a university, it might be a community organisation, it might be a private organisation, or it might be a public sector organisation like the council or a hospital or something like that. There's slightly different ways that it would be implemented depending upon the role of the organisation and the staff's roles within those organisations. So there's no absolute one way to do this, to introduce a Working Carers Passport. It's basically possible to introduce one which best suits your organisation's needs and the the working carers within your organisation, because it will always be a balance between the organisation's needs and the needs of the individual as a working carer. Because I think that always has to be kept in mind when an individual who is a working carer approaches their manager for support around their needs as a working carer. That I can speak from personal experience, as I say, having been a carer for my father for more than 15 years, that when I've been in circumstances where I needed support around appointments, around flexible working, around time off, that I've been able to approach my manager, and my manager's always been very supportive of giving me as much flexibility as they possibly can within the needs of the council and within my personal needs as a carer. But as I say, it always has to be with a balance between the needs of the organisation and the needs of the carer.
Thank you, Tony. I'm just going to go to the chat box. Varsha is saying that there may be times when we need an extended break, especially at times for discharge. I have had to use annual leave. Is there something within carers' rights that give working carers the time off? Tony?
Good question. At this moment, there is no statutory right to extra care off, specific care as a carer. And that's whether you're a carer who is recognised because you get carer's allowance, or whether you don't claim carer's allowance. There is no specific allocation of additional leave from annual leave that is allocated to carers. There's been conversations at central government level about the potential to introduce a carer's leave quota, or whatever you want to call it, as part of support for working carers. But as yet, that's not got anywhere yet. That's been pushed for by organisations like Carers UK, Carers Trust, when they're engaging with government about the needs of carers. But nothing has emerged from that at this point in time.
Okay, thank you, Tony, for that. Meg is also saying that at Leeds we have a similar approach, but a more specific one around appointments, time off, etc., based on individual needs. Unfortunately, statutory time off allowed is for emergencies, which is unpaid, a potential of 5 unpaid days in the future. And Laura said that each organisation will have different agreements within their policies. So really important to familiarise yourself with the policies. If you need support, contact your HR team to check. And the details will be in your staff handbook as well. So it's always best, like Laura said, to just check with your HR department or your manager. But Tony, thank you so much for that. Does anybody have any more questions before we move on to Tony? Move on to Helder. And Fatima will be putting some questions in the chat box for the poll, so please, I would encourage everybody to answer them questions. Thank you, Tony, for that. So without further ado, I would like to introduce our next guest speaker, who is Khalda Ashrafi. Khalda is the Equality Lead at Bradford City Council, and she will be now sharing her personal experiences of being a carer. Welcome, Khalda.
Thank you very much. It's often the case that me and Tony get mistaken for each other, don't worry. So thank you for the introduction. I'm not actually here wearing my equality hat as such today, but whom I did ask me to come along and just share with you some of my experiences of being a carer. I'm a named carer for my sister, Suther, and I just thought I'd show you a picture of her. I don't know if you can see her properly there. There we go. So Suther obviously has been in our lives, you know, for all our lives. Suther is probably about, I think she arrived when I was 8. So just to tell you a little bit about Suther. So when Suther was born, as her development progressed or didn't progress, we started to notice that there were certain things that she wasn't doing as a baby, and my mum and dad very quickly picked up on the fact that there was something not right. Then she started having fits. She had convulsions which were quite serious at a very, very young age. So obviously then the investigation started. And what we learnt from the investigations, and I mean, don't forget, this is going back a good 32 years now. We learnt that she was actually born with a defect in her brain, and that part of her brain on the right side hadn't formed properly, and that there was a cyst, and that because of that, because that impacted her development, it meant that her left side and all of the functions governed by the right side of her brain were affected. So she has quite serious cerebral palsy. She also has autism. She's autistic, but the autism and the epilepsy are probably not a serious an issue in terms of her whole makeup and what she needs in terms of care. So she's non-verbal, but she has her own way of making us understand what she wants on a daily basis. So it's never a problem to know what Sadaf wants. She loves Indian music. She's completely fascinated by some English music, I think, that have repetitive tones, like the Venga Boys. She loves Atif Aslam, which is a very popular Pakistani artist. Anything that is on B4U Bollywood will keep her entertained for a good long period of time. But the challenge.
Apologies, Fatima, can you put on mute, please?
Sorry about that. I've just muted everyone. Thank you.
Sorry, Khalda. You're going to have to unmute yourself, Khalda. Sorry. Fatima, can you unmute Khalda? I think you've muted everybody.
Khalda, you need.
You're here. Wonderful world of Zoom. Apologies, everybody.
No, not at all. So yeah, so I was just telling you a little bit about my sister. So obviously the investigations, reveal what they did, and she is what she is, but she brings an awful lot of joy and happiness to a household where, when I was a child, we grew up in quite a strict environment, and so that's being there, and because she was non-verbal, meant we had to use a lot of touch and hold her hand, and I think she kind of brought that to our family in a way that perhaps, had she not had the issues that she has, we wouldn't have really recognised or dealt with. And as a result, I think we're much more affectionate family than we perhaps would have been, had she not been there. So just to talk through some of the challenges. When sort of situation came to light and there were investigations going on, it meant that, as a child, I had to kind of like just be on alert, to look after her if my mum and dad were doing something or in other parts of the house. And that was, so, I was probably 9 or 10 at this point, when the investigation started. So my experience of being a carer was sort of comes from a very, very young age, as probably a lot of people do when it's a sibling. I remember my parents taking time off to go to various different appointments and, and different sort of like assessments that happened to ascertain really what sort of situation was and what the needs would be. And I think, as time has gone on, we've kind of like had a lot of, sort of like, we've had a lot of support for Sadaf, but there have been challenges on the way that are probably no different to any challenges that anyone would face with a child or a sibling with cerebral palsy and learning difficulties. But I think I wanted to talk a little bit about some of the cross-cultural issues that we experienced, that I recall as a child and also as an adult. So I remember the first time we took Sadaf to Pakistan, and she was very young. She was only a child, but I remember distinctly we were on a train journey, and when Sadaf gets upset, she bites her hand, or she might even just like hit her forehead, and that's an indication that she's stressed out, and that's an indication that she's not happy. And we're on a train journey from Hyderabad to Sakha, and because I think probably the heat was really stressing her out, she started biting her hand, and the guy sat opposite us asked us if she was like loopy in some way. And I'll never forget that, because after that, my mum decided she would never take Sadaf to Pakistan again. Although our family were very supportive, that one incident, really, really, I think pushed buttons in my mum and in all of us. to make her feel that Southwark really wasn't appreciated or welcomed and understood in the way that she should be. And possibly at that time in Pakistan, there just wasn't that much awareness, as there maybe is now. So I remember that very, very well. I also recall, various different instances, even in the UK where we've taken Southwark out, and again, we've been in a shopping centre, and people have just stared at her. And she was only like probably 8 or 9 at that point, but she was in a wheelchair, and people's unpleasant, well, not, I won't say unpleasantness, maybe it was curiosity, and maybe it was just a lack of understanding, but it was very unsettling and it was very discerning and it was quite uncomfortable. And I just wanted to, I guess, just mention that sometimes we don't often realize what our own reactions are, and a lot of those reactions came from people who were of a similar background to us. And I don't know if it was more curiosity, or if it was just like lack of understanding, but because those were reactions coming from people who looked like us, we felt it more, and I think that is something that I just wanted to, to comment on and share. I just wanted to then go on and talk a little bit about obviously when you have a child or a sibling that has learning difficulties of any kind, that brings with it a whole range of challenges that are about, understanding and care and medication and, appointments and medical support and, what kind of support they need on a day-to-day basis. And I think on that regard, we've always been very lucky with Southwark. She was, she's always had really great, school support and then day centre support. And even now, at the moment, so that what happened was when lockdown happened, she has a respite centre. And because in lockdown, and again, if you don't have a child or a sibling with learning difficulties or a family member, you may not automatically realise, but in the lockdown, all of the care support that was coming into the home stopped. So although Southwark was she was at a centre during the day, she would have somebody that would come in after school time, help her to get changed, have her dinner, get dressed for work, for bed, and then our carer would be there 5 till 7, and then we would put Southwark to bed later on. But we weren't able to access any of that because lockdown happened, and it meant that if it wasn't somebody that was in your bubble, they couldn't come to your home. So what we discussed then with Southwark social worker was, and the care place, the respite centre that Southwark would go to once a month, they offered to take Southwark in for the period of the lockdown. Now, at the beginning of the lockdown, we were anticipating a month to 3 months. And the upset that this caused my mum was like, it was no end, because she's always felt when Southwark goes into respite that it's almost like some kind of, like a comment on her not being able to look after her, my sister. But with time and time, we've explained again, it's not that. It's really about you needing a break and Southwark needing a break, and having that time away. And Southwark's always had a really, really positive experience in her respite centre. So anyway, we talked it through, and what we agreed was that Southwark would go to the respite centre at the beginning of lockdown. But if at any point, my mum felt that she wasn't happy there, we'd bring her home, and then we'd look at how we managed that process. Anyway, Southwark stayed in the respite centre the whole way through lockdown, and is still there. But now her time is split between home and the respite centre, because my parents are aging in the way that, obviously they're at an age where they find it very difficult now to manage everything. And now that we can have carers, for the time that Southwark does come home, we can now have people to come and support her in the time that she's at home. But it was quite a challenging time, I would say, not just for my parents, but for Southwark and for me, in terms of just being able to oversee that process. But one of the most amazing things that the respite home did, which they still do, is at 5 o'clock every day, either me or my mum, we have a FaceTime chat with Southwark. So we get to see her, we get to talk to her, she gets to see us, we get to play some music, and it's just like, but it's a really good sense check of how she is, because we know just from looking at her, even though she's non-verbal, whether she's well or not, and for the majority of time that we see her, she's absolutely fine, alhamdulillah, which is, really, really good to know. But that link over lockdown, when we couldn't have Southwark come home, as you can imagine, was really, really vital, really important. And we're so grateful to the respite centre for for doing that. They must have been so busy, but they had Sadaf and one of her carers there sit down with her for half an hour every day to do that for us. And that is something that, you know, we still really appreciate. Just like other cultural and, you know, sort of like stroke religious considerations, when Sadaf first went into respite over lockdown, one of the things that my mum was really adamant about was that everything she had to be halal. You know, now for me, it was very different because my perspective was she had to be well, she had to be fed properly, you know, and so long as, you know, me and my dad felt that as long as she wasn't eating anything that we really, you know, would disagree with, like, you know, no pork products, that we didn't mind that she had meat if it wasn't halal. And that was just a conversation in my family between me and my dad and my mum. I'm not saying that this is the status quo everywhere, but, and because, you know, Sadaf is of, you know, like the learning difficulties and level that she is, you know, for her well-being was more of an importance. So we kind of like managed to find a middle ground with that. They provided halal meals that they ordered in for her 3 times a week. You know, the rest of the time it was fish and vegetarian, and that was absolutely fine. So what I'm saying is, although, you know, this was something that was of more concern to my mum than it was perhaps to me and my dad, what we did was we worked with the respite centre to make sure that we got to that level where she was happy. My mum was, you know, like, and I mean, I know that this is about being a carer for, you know, my sister, but managing, you know, my mum's expectations and feelings was also really important. You know, I mean, you know, for her to not feel that she was in some way failing my sister was, you know, huge. And, you know, and the period of lockdown continued where, you know, we thought it would be 2-3 months, but actually it was much, much longer. And then things have progressed since then. So I just wanted to share a little bit of that with you. So where we are now is that, you know, Sadaf spends half of her time in the respite centre, half of her time at home with mum. But because now we're not in lockdown, we've been able to re-establish that contact with the carers coming in, which really helps my mum. Sadaf, for all, you know, all of her silence in terms of being verbal, as soon as she comes through the door, she knows exactly where she's going. She has a particular chair in the lounge. She'll sit there. When it's dinner time, she'll march through the kitchen and come and sit in the dining room in her chair. You know, she's in Urdu we have a word called nakhra, which means you know, all of the snobbery that she showed when she used to be at home all comes back when she's at home. She'd eat anything in the respite centre, but when she's at home, she looks very disconcerted if we don't give her Asian food. It's like she looks at you like, I'm here. I want, you know, what you normally make. Why are you giving me eggs on toast? But in a respite centre, she'd be happy with it. So, you know, all of those kind of like little idiosyncrasies about her come back as soon as she comes home. So there are challenges within it, but within that, I think what is really important is having the dialogue with the care providers and the families, and making sure at the heart of that, what we do is put Sadaf at the heart of that. There are still situations where I've had to ask for time off. There were pre-lockdown. There was a situation where, because my sister's epileptic, her medication wasn't as effective as it used to be in controlling epilepsy. So she was hospitalised on 2 or 3 occasions over the period of maybe a couple of months. So in that time, I really needed to be there to support her and to support my mum and dad. So, but again, I had to work that through annual leave and unpaid leave to do that. So again, you know, like you've got to just, like, I guess, work with your employers to find out what the best way is in order to have that time to do what you need to do. So I'll leave it there. I'm happy to take any questions, and I'll just show you my sister's picture again. This is the best.
What a beautiful picture, and thank you so much for sharing your personal experiences with us, Khalda. That was very insightful. And Sadaf sounds like a wonderful person and character, somebody that you want to really be around. Does anybody have any questions for Khalda? John, you have your hand up. John, are you there? Do you want to just unmute?
I think, you know,
can you hear me?
Okay.
Yeah, sorry, even after 3 years of this, I'm still getting mute and unmute wrong. Anyway, thank you, Hada, for a really, really moving lived experience story. I think that's really fantastic. And we're here to have these conversations precisely about this type of experience. I'm just wondering, really, who cares for the carer? because clearly within this is how you take care of yourself, and so you can look after your sister in the fantastic way that you do. How do you kind of discharge, I suppose, the emotional weight of looking after your sister?
Wow, that's a brilliant question. I think my focus is always on making sure they're okay, and then I mean, my mum and dad, obviously, like you can probably tell from my age that my parents are elderly. So, my focus is always on when it's not to do with Southwark, it's really to do with making sure that they're okay, that my mum is okay, my dad is okay. Their wellness is just on a very fine silk thread where if they're both okay, everything is fine. If one of them's not okay, then everything kind of can fall to pot a little bit. So that's not answering your question, probably adding to the question rather than the answer. So where do I get support from? So I have a really good friends network who helped me a lot, just in terms of having that time to let my hair down and just talk about other things and just release stress. But I think the thing that not worries me, but the thing that stresses me most is if one of my three, so my mum, my dad, and Southwark, if one of them isn't well, then fortunately for me, they don't live that far away. I can get there. But my biggest stress is how do we deal with those situations where Southwark's not well, like the time when she had to be in hospital. How do we make it okay for everyone else in that kind of caring network to be able to feel okay and be okay, not knowing sometimes what the outcome is going to be? And I think for me and my family, I think that's a really big thing. I don't want for my parents to stress out and for it to impact their, health, and that can sometimes be the issue. But in terms of, currently I work for Bradford Council. I haven't needed to take carers leave at any point. But I am coming up to a point where my mum will be going in for an operation, so I will be asking for a couple of days off. But most likely, I would assume that will be annual leave. And I think Tony's group, which is very much at the staff network about looking at the needs of carers, is one of those places where if I needed to, I would definitely go there for support, to ask Tony or other group members within there to say, look, I'm coming up with this challenge, can you share with me how you've dealt with it? So I think for me, working in Bradford Council, that would probably be my first port of call.
Okay, thank you for that. Yeah, just to say, don't forget, you need caring too. I think that's a message I'm trying to get across. Thank you, Khalida.
Absolutely, and I think thank you for that, Khalida, and a great question, John. And I think sometimes we forget as carers that we also need support sometimes as well, and sometimes that can be overlooked. I'm just going back to the chat box. Sorry, Abu Bakr, you was it Jeff first and then Abu Bakr? Sorry, I've just noticed. Jeff, do you want to come in first and then I'll bring Abu Bakr in?
Got there before me, so she wants to go for the one.
Oh, okay, sorry. Abu Bakr, do you want to go first then?
I'm happy to go first, but I think Jeff was before me, but never mind, that's fine, thank you. Khalida, assalamu alaikum.
Walaikum salam, long time no see, so lovely to see you.
I know, after all these years, who would have thought? MashaAllah, you're looking well.
Thank you, and you, and you.
Unlike some of us need to do our roots, you're doing well, MashaAllah.
Yeah, I've got this spray.
I need to get just the men out. So really, my question is very similar in terms of carer journey, and trying to sort of work through some of the taboos in terms of that stigma, really. So just a statement and then a question, if that's all right with you, Khalida. So when my mum had her second, when she had her first stroke, actually, my sister actually did her rehab, because the rehab facilities were not as they should be, obviously, because there's such pressures on the NHS and stuff. So actually my sister came and stayed for 6 weeks non-stop and got her walking, talking, eating independently. And in that time I made the decision with my mum to say, actually, Mum, you've done everything for everyone else. This is a time where we need to look after you, really. And I said to her, I'm going to try and get you some home care, which is sort of culturally appropriate, sensitive to your needs. And we ended up having this massive sort of bun fight, which was about respect, about honour, about tradition, about extended family and the role that they should and could and would or not play, if you know what I mean. And long story short, which is actually I did get the respite. I managed to get the workers in. I managed to get, she actually loved the Polish lady that used to come in, and she used to make better chapatis than some of our Asian ladies that were coming in. So she'd managed to teach someone a skill who had no idea of how to make things, if you know what I mean. So it was very beneficial for her to not only get something, but also give something back at the same time. So I tested my mom and I said, like, right, so you've had this, you've had this system now in place, and you had, anxieties at the beginning because of those cultural taboos. I said, right, now you've had it, I'm going to take it away. He said, no, don't do that. So no, I can't. No, these are my, these are the people that come in 4 times a day, and they're giving me, they're giving me support, they're looking after me, and I'm giving me that social interaction. When you're not at work, I get, I get so many more benefits. And that journey took a while. So how did you manage those, those taboos and those myths and that stigma? How did you manage to navigate it? I've just shared how I did it.
Yeah.
With my mom. How did you do that? Sorry, so long-winded, but you know me, Khalid. I can talk to you for England.
What is reassuring is that it doesn't matter how long afterwards you bump into some people. A, you feel like you're just picking up where you left off, like maybe even 15, 20 years ago. But B, that they haven't changed. I love that. So, Bakar, I mean, what a wonderful story that you shared about your mum and her care and what has supported and benefited her. I love that. I think for me, particularly with my mum and dad's journey with my sister, one of the things that I hadn't mentioned that I had thought about mentioning was when Southwark has been in respite over lockdown. One of the things that my mum was very keen to be very vocal about was that she didn't want for her to be cared for or handled by a male carer, and a lot of that was backed by, I guess, her feeling of, oh, this is a daughter and I don't want, for a man to be changing her or, that kind of thing. So again, the way that we navigated through that was to speak to the respite centre, explain my mum's concerns, and then what we agreed was that most of the caring staff were female, but there were some male caring staff members, but that we restricted what they would or wouldn't do with Southwark. So they would take her out for a walk, engage her in activities, feed her, but they wouldn't do any of the personal care, and they were good with that. So all of Southwark's changing, bathing, combing, putting to bed, getting out of bed, the toileting, all of that was done by a female. But the other things they negotiated, and a lot of that. So for me, it was 2 things. It was putting Southwark at the centre of what needed to happen. So it was really about making sure that she got what she needed, and then B, it was having that effective communication with who provided her care. So if it was instances where we weren't sure and it was to do with the respite centre, then we spoke to the respite centre and we carried on dialoguing with them till we got to where we needed to be. If it was with our carers that came into the home when Southwark's at home, then obviously we have more, I suppose we had a bit more jurisdiction over asking them to do things in a particular way. But it's funny that you brought up the story about chapatis, because when my mum was in hospital, probably a couple of 2-3 months ago, when she came home, she wasn't very mobile for a few weeks. No, she wasn't mobile, but she insisted on being mobile. But we did have one of my sister's carers come in extra time then and make roti. And just a couple of weeks ago, I was at home and this carer had made the roti, and my mum and dad both sat there saying, "This is so nice. This is just like we make it." So obviously, chapati making is a big thing in terms of the care that needs to go into Asian households, because it is the bread that we eat most of our meals with. So I can completely understand that one. So I don't know if that helps, but that's kind of like some of the journey that we've done.
I think it helps. I think it helps to a point that people like ourselves who have been in the system and who can understand and navigate the system, and who can work with health professionals and other professionals, and not get that white coat syndrome, you know, that syndrome of the doctor knows best or the professional knows best. Actually, no, it's my mum, she knows best. Yeah, it's my daughter or whoever it is, they know what they need. But we're able to articulate with confidence, actually, no, we disagree, but this is the reason why we disagree, because we've got a better, not a better solution, but another lens of looking at these things. And that, so my journey with my mum was at the start when we didn't have many ladies from the community doing home care in our area in Batley. So it only just started. But what I said to my mum was, this is a benefit not to yourself, but these are ladies who are, you know, who are unfortunately maybe divorced or widowed or who don't have English as a first language. But this is an occupation that gives them, you know, some sense of dignity for themselves, and where we're only almost making it acceptable, where people that need help, deserve help, can get the right help that they need from the people that they've got confidence in, that they can communicate with, who understand their cultural sensitivities. Since what's happened since then in the last 10 years, that industry has mushroomed. So we had one provider, and now we've got a number of providers. We had a handful of ladies from the community doing home care work, but now we've got, you know, a lot of ladies now seeing this as a career for them. You know, it works with their time frames and how they, you know, how they view khidmat. Now, if you in Urdu, there's a saying in our tradition. There's a saying, "Ibadat se milti hai jannat." So when you dedicate yourself to the worship of your Lord, the end is that you will be rewarded by paradise. You know, khidmat se milta hai khuda. But however, if you serve humanity, you get the Lord Himself. You understand? So there's a framing of why people do what they need to do. But there was a tricky period where logo kya kahenge? So where will honor and respect and all those things come in? So it's a simple way of getting people confidence to get over that barrier. And what you said was, you said it really well. It's not about other people out there. It's about that person first and in the center. And how can we all work to make sure that they get the things that is going to enhance their quality of life. And at the same time, we're maintaining their dignity and respect. And I worry about people who are not as confident or who cannot navigate and who are then left, you know, picking up the pieces.
Yeah.
Sorry, end of soapbox. I'll let someone else jump in now.
Absolutely. Thank you so much, Abu Bakr. We've got Jeff who's had his hand up. Jeff, hello.
Hi, I come from Australia. I was a support worker for 20 odd years, and I had a stroke age 37. And I work for a charity called Different Strokes. So we now, for people under age 65 who have stroke, so we're trying to support the carers as well as the stroke survivors. Well, I hate the word tech carers because it's like because I've now got a disability, I suddenly can't have friends anymore. They have to be carers. And I absolutely hate when people said, when I live with a friend and people go, "Oh, is he your carer?" No, he's not. He's a friend. Friendship works both ways, and we support each other in different ways. As you can gather, I've got a sling on. I've had a fall, and that's one of the things was that I've been waiting for a year for OT assessment and still not had the OT assessment. I do find that sometimes one of the things I worry about is that the social care probably saves money, tries to save money by cost, and actually incurs further costs in the long run. Before my stroke, I was a carer to my dad. Before that, with my mum, and then my dad fell ill after my mum died. And I was commuting for 2.5 years between Leeds and Scarborough, bringing him back for appointments. And social care did not offer any support. They went, "Oh, you're doing really well." It's like, no, I'm not. That's why I've called you in. So there's that sort of support of my family weren't very good supportive. They were had their own agendas. as well. So it's how can there be some sort of way where people can work together as well within the families. My dad actually died shortly after my stroke. He had a fall and he got burnt. He had liver disease. He got stuck between the bed and radiator and got badly burnt. And I drove over to sort out everything. He was on the way home. I had my stroke. He died a few months later. And one of the things you were saying about keeping the personality is that my dad, even though he was meant to be in for 2 days, he lived for 6 weeks after the stroke, and I was still commuting between Leeds and Scarborough, even though I couldn't work. I had to look after my health because I was still recovering from a stroke. Was that I made sure the staff knew that he wasn't going to be this patient. He needed that he was an individual. So I just went through being a background in care worker, probably a nightmare. And I was like, this is my dad. This is what you can speak about. This is what you think. And they managed to put in certain things in the house in this room. So they put up a special, they put up a display cabinet, which is pretty much like that. Sorry. Because my dad was a bus driver and he collected model vehicles. So they put up that display cabinet. So they made it, although he could have only been there a couple of days, they made him felt like it was his home. And that quality of care, it's amazing how someone can change so much when you get quality care in. And at the moment, my grandma, who's 94, is in a nursing home in Haddle. And again, they're expected only to live a couple of days when they moved her from hospital into adult. And now she's actually got a lot better. That now looking at long term, that she's going to be living for a lot longer. So hopefully she wants to live to be 100. So and it just proves that care that's in there is good for not only the individual, but also for the family around it. And just going back is the cost support there. But also, is there some sort of way that your family actually work together, or do you sort of get everything dumped on you, or does other relatives help out? Or because obviously you've got to look after your and obviously you've got to look, because for example, my grandma's care, I couldn't really help much because of my own health, and there's a lot of internal politics. Do you find some sort of approaches between whether somebody independent would come in and help out with getting the complicated relationships going? Because
yeah. So Talda, could you just answer Jeff's question, please, as to what support and how you work with your family?
So Jeff, this may surprise you to know that other than outside of me, my mum and my dad, and my sister and my brother that lives abroad, I actually don't have any relatives in the UK.
right.
So I'm not actually related to anyone else. And I'll just share with you that there are days when I'm not even sure I'm related to my own mum and dad.
Yeah, I've known that myself.
Yeah. But what we do is where Southwark is concerned, we work as a team, and we have to. You know, there's only the three of us, and you know where issues come up with regards to her health or one of their health concerns. Because the other thing that I can tell you about my family is I'm born into a family that have signed the Official Secrets Act against each other. So the minute my mum is ill, she'll say, "Don't tell your dad, and definitely don't tell your brother." And the first thing I do is I pick up my phone to my brother in Dubai and I say, "Look, mum's not well and this is happening and I just need you to know." So then he can make a decision about, you know, so managing the family situation. I'm just sharing with you my situation.
Sounds like your family's a lot more supportive of each other.
Well, I think.
But as for secrecies, I've 2 years ago I had my appendix burst, and I did a triathlon 2 days before, and didn't tell anybody that I was having problems with my stomach until I came home. My friend came home and found me in and out of consciousness. So that proves how I'm very stubborn I am. That's why he's made sure I'm wearing my sling so I get support, because I'll be out doing stuff if I could. But that's the other thing. As being a carer, you're used to doing stuff for other people that you don't like being looked after. You don't like being the patient, and I think that's probably the thing with your mother as well. She's the mother.
Absolutely, yeah. And I think, you know what, I think, Jeff, you know, I mean, your story is incredible in terms of how much you've looked after and supported people around you. And I just hope that you're getting the support that you need right now. But you really hit the nail on the head, where people that give care often feel that if they now need to receive care, that it's in some way, you know, like saying something about them not being strong. And I've had to have those conversations with my mum a lot to say, look, it's okay, you know, like for you to need a bit of support yourself, you know, and for you to take that support when you need it. And I, you know, whether that's me going over a bit more, or whether that's her not religiously cooking 3 meals a day, you know, and maybe having a takeout every now and then, you know, but I've had to kind of address that with her in lots of different ways and on a number of occasions, which I'm sure.
I know I'm going to get bothered because of my friend who I live with was meant to be helping me out, and I've actually changed his the cat litter tray. He was meant to do it, but he has not done it. He said, I'll do it, and I've gone and done it myself, so I'm going to get telling off later.
Yeah, and then there's that as well, isn't there, where the person that needs the care does something themselves. And I'm like that. If I go home and I've said, oh, I'll do this, and then I've got there and my mum's already done it, I'm like, why did you do that? I was here to do that. That's why I came.
Yeah.
So yeah.
Thank you. Yeah. Sorry, I'm just a little bit conscious of time. Thank you, Jeff, for sharing your story as well. It seems like you've had a lot to deal with, you know, caring for multiple people at the same time within your family. Shaheen is with us from the West Yorkshire Healthcare Partnership. So Shaheen, maybe you can put something in the chat box as to, you know, how people can get support, if there's any local support groups that, you know, people can access, because it's really important that as carers we are looked after as well, like Jeff said. And thank you, Jeff. I hope you do get some support that you need at this moment in time. I'm just going to go on to a couple more hands and then go on to our next speaker. So Varsha, sorry, was it Varsha next? Yeah.
Thank you for inviting me. Just to cut a very long story short, my mother-in-law, she had, they tried to put a stent into her and her heart stopped. So in reviving her, they broke a few of her ribs at that point. She came home. She had a fall, she fractured vertebrae. So you can imagine she's flat on the bed. As carers in the family, we don't get any training in terms of lifting and handling. And I think this is really essential, because otherwise you don't know how to do it correctly. And for myself, I actually joined I gave up work. I joined a domiciliary care company so that I get the training. I had to be a bit, I don't know how to say, you know, find different sources of things to get, because this is really essential, you know, and also around, you know, if people start looking after the elderly, the Mental Capacity Act in this country is quite specific. And as Asians or whatever of different cultures, we don't understand it. So I took on, you know, because I was home, I was climbing up the walls. And I took on myself to do some research work around, and I set up a dementia cafe in our front room because there was nothing available for people who spoke our language. And the worst thing is isolation for a lot of people. So this way I got support because I could talk to other carers who were in a similar situation. And our loved ones came. It was called Chai and Chat. And we'd do a bit of music and whatever, but that kept my sanity in some way. And also by working in the system, I learned enough to then, when my mother-in-law passed away, get a job in the NHS. So I just wanted to say that there are times, the traditional, you know, if you wait for the system to help you, it's very, very difficult. And I can only say that from my experience, that just being a bit more proactive, reading around and seeking support wherever it is, and actually try to understand the system helps. Thank you.
And it's so true, Varsha. Thank you so much for sharing your experiences as well. And, you know, often within some cultures, it's just expected that you will just look after a loved one, and there's no thought that goes into it. And especially with, you know, with handling and lifting, and, you know, how does somebody do that? So, you know, you have to be self-taught in a way as to how you look after a loved one. So it's really important that we do get that support, but, you know, sometimes it can take a while. And then, you know, stubbornness of, the person being cared for. They don't want to be looked after by somebody else. So, there's so many issues within different cultures that people have to experience, especially the carers. So thank you very much for sharing that, and please feel free to put any suggestions in the chat box and really utilize that, and any links, Shaheen, that people can use and access. I'm just a little bit conscious of time, and I'd like to introduce our next speaker. Meg and Ian, would you be kind enough to put your questions maybe in the chat box, and then we can pick it up after the session, if that's okay. Thank you. So now I'd like to introduce, so thank you, Khalda, for that. And, it was great. There's lots of messages for you in the chat box. So thank you, everybody. I'd like to introduce our next panel speaker, who's Javad Nizami. Javad works in a residential care home within Leeds City Council. He's a deputy manager, and he will now be sharing his story of being a carer. Welcome, Javad. Can you put your camera on, please, so we can see you?
Hello, everybody. I'd just like to apologise that I can't put my camera on. Okay. I'm having issues with my laptop, and it's just not allowing me to. I've been messing around with the settings, and I can't get it to work. So apologies that I can't turn my camera on. So I'm going to speak.
Okay. That's fine.
So I've heard a lot of interesting kind of stories, kind of people's take on their kind of interaction with the healthcare system in terms of providing care for their loved ones. So there's a whole range of kind of a spectrum of experiences that people will go through. So I'm going to talk about my experiences, and then I'm going to pick up on some of the points that were raised. So I kind of worked in residential services from the start of my career many years ago, and I've kind of worked my way up through the system, and I've got to say my employer has been very good in terms of recognising that individually, obviously I care for my parents, and culturally there's an expectation. I'm the oldest son in a family, so that there's an expectation on me to be the main carer. My mum lives with me, and I take on the kind of the majority of the care for my mother, and I'm supported really well by my sisters in doing that, and it remains my responsibility to kind of coordinate that. So I've been very lucky in that I've kind of worked with a group of people, because we work with young people and it's talking about emotions. We're kind of more understanding of each other's emotions, and so I've been able to share kind of my responsibilities, and my colleagues have taken that on and have been very flexible. So, there were in the chat, there were various kind of resources that are available. So yes, I can have special leave up to 5 days working for Leeds City Council, and that's kind of discretionary as well. It's paid, it's discretionary, and I can mix that with changing my shifts or changing my working pattern, flexible working. So I can use annual leave as well, a combination of those things. So I think it's important that that for people who are carers, that they share that with their managers. So when they're having supervisions or appraisals, that you need to make your manager aware that this is your personal situation, your circumstances are this, and then I'm sure that they will kind of make allowances for your changing your shifts or allowing you time to go care for your loved ones. So I've been in a position where I've done that. I've talked to my managers, I've talked to my colleagues. You have to be open. It takes a certain level of kind of confidence to be able to do that. And believe me, you might feel that to start with, what people are going to think. Everybody is in the same boat. Everybody has somebody that they care for. Everybody has somebody that they love. So share your feelings, share your thoughts, and people will respond positively to you. That'd be my message to everybody. So having done that, kind of, I've been able to kind of work around with my sisters, with my family, kind of ways to make sure that my mum attends her appointments or is able to kind of communicate with the doctor, make appointments. So one of the points I'd like to make is that there's a massive strain on our health system at the moment, and our health system is changing. I'll give you an example. My mum got a letter to say that we've done a Zoom, we've done a Zoom meeting in which we're going to talk about diabetes. Now, this was like a new concept for my mum. It's like, am I seeing a doctor? But how's he going to sort of sort that out over the internet? So, you know, so there's a kind of a bit of learning there to be done by the NHS in terms of approaching people from different cultures or people of a certain generation that might not use technology, and so there's a hesitancy there. So it took me, believe me, it took me a lot of to-ing and fro-ing to sort this out. There was issues with logging on. I got back from late work and my sister took over, and then my other sister got involved. So it takes a lot of effort and a lot of coordination. And obviously, while all this is going on, it generates a lot of anxiety for people as well in terms of their own emotions. So you know, it is a very difficult thing, and I think we're going to have to kind of learn to operate in this newer version of the national health. It's not simply a question of going and seeing your doctor or, you know, having people come to the house. Things are changing. The way that the services run is changing, and I'd just like to pick up on I think it was John who raised the point about self-care. I also think that it's very important that people develop kind of ways in which that they can, you know, people that care for other people will obviously they need caring for as well. And some of the ways, I'm very lucky that I work in an environment that we teach young people how to regulate their own emotions and deal with any issues that they've got. So we have a thing that we do. We call them check-ins, and basically we talk about how we feel, and we do like mindfulness exercises. So that's breathing exercises, regulating your breathing, kind of being in the moment, and so the ability to kind of switch off from when you're at home, you're a carer, but when you're at work, you've got a different role. So being able to kind of switch off from one role to another, and working out ways that you can do that for yourself, for carers, is very important. And I think when Tony was talking about making people aware of, you know, what's available, what support is there out there for you, I think it's very important that you find out and you use everything that's available. And it is an issue that not everybody is aware where they can access support. So it's very important that we do that. So I'm going to stop rambling, and I hope that I've let you know of my experiences, that I'm going to give other people an opportunity to speak about theirs.
Thank you, Joel. That was really helpful, and thank you so much for sharing your personal experiences. I mean, we were delivering on the COVID prevention project for ethnic minority communities throughout COVID, and we found that, you know, a lot of our grassroots organisations that we were supporting had to take their services online, you know, to carry on and continue with that support to service users, especially on Zoom. And it was, you know, a big you know, learning experience for a lot of organisations taking their services online. So I think the NHS, you know, are taking that step to move appointments online. But then again, you know, for somebody from, you know, from a culturally different background, they will, you know, find it difficult to, you know, understand how, you know, they're still being cared for by their GP. So it's just the education that we need to focus on. I think there was a question from John saying that I've worked in a caring role in the past, but have never been a carer for a family member. It is a very different thing, and it strikes me that it's much harder to have boundaries or limits on what you do when caring for a family member. How do we recognise when we're taking on too much, or put limits on what we do so we don't burn out? Jawad, do you want to answer that question?
Yes, and I think I alluded to it in kind of when I was talking earlier, in terms of we need to be able to look after ourselves. We need to be in a kind of a frame of mind where we can take on some of it is taking on some of the emotional kind of burden of other people, and it is hard for people to do that. So we need to be able to have an outlet I think people talked earlier about having an activity, something that you do. Exercise is generally very good. Having something that you're interested in, pursuing that, so that you can switch off yourself and be yourself in that, be in the moment. You can try mindfulness exercises. So go on YouTube, type in mindfulness, and there are a lot of things that are available, and that's all about regulating your breathing and being in the moment. You can seek support, find out what it is that you've got issues with, find out support. Again, the internet's a great place to get support on that. So those are some of the things that you can do. And ultimately, if you can't find a way forward, then you can speak to professionals in the industry. You can speak to health professionals. You can go to support groups. Find out that I'm not sure whether how kind of support groups for carers. I know we have some in Leeds. I don't know about Bradford.
Okay, thank you, Javad. Meg, can I just bring you in, because you had a couple of questions and you've put some things in the chat box as well, and then I'll bring Abu Bakr in.
Hi, I'm from Leeds City Council. So I'm a HR advisor, but I also lead our staff network, carer staff network. So it wasn't so much a question, it was more really kind of bringing the focus to carers. And I think a couple of people have touched on this, that carers very much don't focus on themselves, because they're trying to balance work, they're trying to balance caring for extended family and their own family, and taking time out is very important, because you need your own resilience. If you are not strong, if you are not well, if you're stressed, then how are you going to care for the people that you need to care for? At Leeds, we carers, I think, it's not an equality characteristic, only in the sense that if you care for a disabled person, then in terms of discrimination, it is factored in. But we are trying very much to kind of raise awareness around carers, because people become carers through life. Sometimes they are, sometimes they're not. It's a state that you go in and out of. Sometimes it's intensive caring, sometimes it's long term, and but there is a difference in terms of being, I get this quite a lot. I support a lot of people that call me in terms of my network role about who is a carer, and sometimes that definition gets blurred. People want to be dutiful and caring for elderly relatives or family members, but those people can be independent or are independent, and it's really very much about people who are not independent, that need that day-to-day support. And really, if you weren't there as a carer, they wouldn't manage those basic things that they need to do. And we're a large organisation, but we still have managers, we still have people who don't understand what a carer is. And it's very much about raising awareness, because people just do it, don't they? They just do it because they have to do it. It's part of life. If you're a parent of a child with medical conditions, or whether you're caring for elderly parents, you just go about your duty and do it. You don't say, look, I'm a carer. But it is about making sure your employer or people around you know that that's another kind of dimension to your life, to your, if you're employed, to your role as an employee. And I think someone mentioned that it's important to let your manager know. It is, and you don't have to go into details about it, but if they know that you might have an issue, maybe further down, or need support further down, then at least you've pre-prepared them. Because I find that a lot of times as a carer, people kind of leave it to the last moment, and then it's crisis. The crisis point, and managers are not equipped necessarily to deal with that, or to know how to support you. So in a way, it's like having a plan B. You have plan B in place. You put something in place for the person you care for, in terms of what you would do in certain circumstances. But it's about yourself as well. And even if that's taking 10 minutes out a day, just to do something for yourself, and a bit of me time. because people forget to take time out to have me time, and that as a carer, that's very important.
Yeah,
because
absolutely.
if you're not strong, then how are you going to care for the others? So it was just an observation, because some really, you know, kind of stories there, people sharing their experiences, but very much about kind of, well, we just get on with it, you know, we do it.
Yeah.
But really, you've got to recognize that you need, you know, and it de-stresses you. Even having a rant with you know, somebody, just getting it off your chest can really be helpful. I just wanted to flag, I know time's tight.
No, that's fine.
In Leeds, we have an organisation called Carers Leeds, who are third sector and commissioned by Leeds City Council. So they are independent, but they are fabulous. And I know there are similar organisations in other cities. So it's well worth finding out who yours is, because they can advise you around funding, around carer assessment. So it's about the carer, not the person you care about. It's about you. You know, they'll put you in touch with support groups. We in Leeds have a get this right, Mama, befriending service, which are volunteers who go in and give you a bit of time. You know, they'll spend an hour with the person you're caring for. So that it's not a paid service. So it's things like that. And so it's worth finding out what support is available for you as a carer in your city.
Absolutely. Thank you, Meg, so much for that. It looks like that there's a lot of things happening in Leeds and Bradford. And I know that Shaheen's scribbling away. Shaheen and Laura are here with us, and they will be taking all this feedback back to the Unpaid Carers Programme. I'm just going to go to a couple of comments before I bring Abu Bakr and Tony in. Tasneem saying, amazing story. Yes, sadly, there isn't a lot of groups for BAME families, so we have to be creative as carers. And Uzma has said, I agree for the system to help you have to wait. You have to research on everything yourself. Excuse me. I remember my mum having a stroke, and being a mum first time was very difficult, as I was the main carer for my mum, because I had a supporting family and friends, and we got my mum home. We shared the recovery. So thank you for that. Abu Bakr, you had a question. Tony, was it Abu Bakr or Tony after that? Sorry, I think there was a question in the chat. Abu Bakr, did you ask a question in the chat?
I've just put mine in the chat because I'll let Tony go.
All right, okay. And Javad, I think them questions are for you, Tony.
Sure, yeah, thank you. I just wanted to say that, I mean, most people who have been talking about their experiences of carers and support for carers, I think it's really, to those people, basically what I'm saying this is that it's really important that you know that at some point it's reasonable to say that you don't want to be a carer anymore. And I think it's really important to recognize when you reach that point, because you do have to look after yourself to some degree as well. And I'm saying that from personal experience. As I mentioned at the beginning, my father lived with us for 15 years, and he had a number of comorbidities which increasingly impacted on his life and ours as a carer. Sadly, he passed away, and following that, my wife's fairly quickly following that, my wife's sister was diagnosed with terminal cancer, for which both my wife and myself supported her with that, and her husband who had dementia at the same time. When a sister passed away, the brother-in-law was living on his own, and we supported him for a while, whilst initially through his the bereavement and so on. But eventually we got to the point where we had to say at some point, well, you know, we've done 20 years of caring for people one way or another. We had to think about ourselves. And, you know, my wife had cancer herself, and unfortunately recently I was diagnosed with cancer. So again, at some point, I think everybody who is acting as a carer for somebody else does have to think about themselves and make that decision for themselves.
Absolutely. Thank you so much, Tony, for sharing that. And you know, there's a big echo in the room, I think, Shaheen. You know, who looks after the carers and what support is there for the carer. So thank you, Tony, for that. Abu Bakr has asked Jawad, how did you manage a stressful caring situation and the family? And then John has also asked Jawad, thank you, Jawad. Is there one thing in particular that has been most useful regarding your employer at Leeds City Council? I have a personal interest as the head of HR projects at Leeds City Council.
Right. Can I just answer that quickly? First one, I play cricket. Cricket is my life. So I have something in my life that kind of helps me to get rid of all the anxiety that builds up about caring about my mum. So having outside interest, that's the answer to the first question. Secondly, in terms of having an employer, I think dialogue, discussing with your employer your situation, I think that's the most important thing that you can do, because if they know what the issues are, then they can support you. I'm a manager myself, so if I know that my that my team are having issues, then I can kind of sometimes I can protect them within work. I can put them on duties that kind of will generate emotions, or I can kind of talk to them about occupational health, looking at their mental well-being, and discussing. I have in the past asked my team to take leave because I think that they're burning out. So those are some of the things that are kind of very important that a manager does for their employees.
Thank you, Jawad. Thank you. Okay, I'm just a bit conscious of time. Abu Bakr, did you want to say something? You came off mute.
No, just sort of in terms of Jawad's response around having an interest. Yeah, I think having an interest is absolutely fine in terms of looking at your own sort of mental health needs as a carer and to be able to carry on in that caring role. Mine is more specific, where if you're part of a family like you were, and you're sort of leading that coordination and the care planning for your loved one, and no family are ever going to agree on everything all the time, if you know what I mean. As long as people realize that you've got you're working to the best interests of your loved one. But even then, sometimes there's tensions and conflicts and disagreements. It's how do you then manage to navigate some of that? Because I think caring, as we all know, is that some of us view it as not just a duty, but like one of the carers that we've just commissioned a film, a carer from Sally, called Sally from Calderdale, and her film at the end was, it's my mum. Who else is there? I have to do it. I don't have a choice. So sometimes, we want to do it, and we want to do it to the best of our ability. But when you've got negativity coming in, and you've got family dynamics, and you've got that, generational families gaps to a point, which is great because you've got many hands make work, make the load lighter, as they say. But it also comes with its own difficulties, where then you have to navigate and play that part where you have to try and make sure that everyone is on point, that you're doing this because there's someone who needs that love and care and attention, and you're trying to do your best. So I think it's a difficult one where you have to, because I've seen many families.
Yeah, it is. It's very difficult what you're talking about, Abu Bakr.
Yeah. They start off with the best intentions.
My kind of response to that would be validate and educate. So validate people's feelings, negativities, whatever they're feeling, that you have a right to feel how you feel. I understand that. And also then you need to kind of move it on. And also we need to do this. So that would be my kind of.
Yeah. As long as you can make your decisions for your loved ones in their best interest and take out the politics. So I put in the chat that for my mum, we ended up having 3 care plans. Not one care plan, not the local authority care plan, but we ended up having a system where we would make sure that there was someone with my mum 24/7, 7 days a week. And obviously all the family are working, they've got commitments, they've got kids, husbands, wives, all the rest of it. So we ended up with the local authority care plan, a family care plan, and a private care plan, if you know what I mean. And so we had to have this blended approach.
Yeah.
And the complexity was we had my mum, and then we also had my auntie who was bedbound. So we had two very, very high needs patients. They should have been, if the facilities were available, not that we would have allowed them, obviously. For anybody else, they would have been in a nursing home because they needed nursing care.
Yeah.
But we would not allow that to happen to our loved one because that was our choice.
Yeah. Yeah.
With that choice came a lot of complexities, if you know what I mean, and a lot of navigating and that political manoeuvring to make sure that they got the services they needed. Forget whatever else was happening in the background.
And I think, thank you, Abubakar. I think Shaheen's going to touch a little bit on the contingency planning, and I'll introduce our next speaker. So thank you, Jawad and Abubakar, for that. So our next speaker is Shaheen Kauser, and she is the Race Equality Manager for the Unpaid Carers Programme for West Yorkshire Healthcare Partnership. And Shaheen will be sharing her personal experiences, as well as telling us a little bit about what West Yorkshire Healthcare Partnership are doing across the 5 areas to support unpaid carers. So thank you. And sorry, Shaheen, before you come on, Fatima has put a link in the chat box for our survey. Please, could you follow that link and please complete that survey? It's up on the screen now. So I think it'll take about a minute or so. If you can all just answer them questions before Shaheen comes on, it will really help us to evaluate. You can just, I'll just be quiet now. Okay, so that survey will be up for a while throughout the webinar. So Shaheen, do you want to take the centre stage?
Thank you, Huma. So first of all, I just want to say thank you for bringing this together, and it's been absolutely amazing to be part of this. And I just want to thank each and every speaker and those people who have contributed, because it's really been captivating listening to you all. I've not been as active in the chat because sometimes I can't multitask. So I just wanted to listen to everyone. So thank you for sharing. Very, very quickly, because I know that we are running out of time. And when it gets towards any end of anything, people sort of fizzle out in terms of the attention span. So I hope I can captivate you like the rest of the speakers. My experience is very personal, and bravado to all those people who have just shared theirs, because I don't particularly like to share personal experiences. And I suppose that might be something, the way that we have been brought up, or I have been brought up as an Asian, that you keep everything confidential. You put on a brave face, you don't let people know what you're going through or what's been happening behind the scenes. Some of you might be able to resonate with that. I want to share an experience of my mother. So we are a family of 9. So that's 7 girls, poor mum who had to raise 7 girls and 2 boys. My mother got diagnosed with vascular dementia 10 years ago. And at the time, 10 years ago, I don't think any one of us knew what dementia was. What is this illness? How is it going to affect mom? What is it going to do to the family? There was lots of questions very, very early on. Mom all her life had worked with my dad as a business. She was a businesswoman, and would never seen her sit down for a moment. If she wasn't working, she would be calling 20 people, 30 people, come over, have food. That's how we'd lived our lives, is forever serving people and cooking food. When mom got diagnosed, now as sisters and as siblings, we've all been dotted about now in the country. I'm up north. Most of my family is in the Midlands or down south. Who takes the responsibility of looking after mom? So I'm going to be speaking now from a female, as a daughter from a South Asian background, with religion at the forefront and culture at the forefront of everything that I do. Actually, culture takes a little bit of a backseat for me, but I know that that's not the case with many people, because often culture dictates religion, and we start to behave in ways that you think, well, actually, that's not religious practice. And I think, Jawad, you talked about the responsibility of who looks after the parents. So mum and dad then retired and then decided they wanted to split time in Pakistan and split some of the time in the UK. And when they used to come back, two of my sisters used to take up that responsibility. And I suppose it was where my father felt that this is where mum would be better off rather than being dotted about. He couldn't quite look after mum. That was the reality. I was desperately wanting to look after mum, but most of us are all working. What would this mean for me to look after mum? I begged about 4 years ago that I want to take mum. I want to look after her. And my father said, well, fair enough, you can have her for 2 weeks. So what was the first thing I did? I just booked annual leave because I didn't know anything better. Booked annual leave, took time out, but boy, was I in for a surprise because of the way mum had become. She wasn't the mother that I knew. I would be on the phone to my sister, mum's doing this, what do I need to do? Mum's doing this. So there's lots of behaviours that I never understood. She would cry all of a sudden. She wasn't an aggressive character at all, so that her personality was actually really lovely. She wouldn't sleep at night. So I was awake all night thinking, how do I now cope with my mum walking around the house? She might hurt herself, injure herself. So I was scrambling with 5 minutes sleep. And, you know, you can only go so long without sleeping. In the night, getting up, and then I can't function during the day. So it had a real impact on my health. In that week, my father then picked up the phone and said, right, okay, enough is enough. I'm going to have to pick her up and bring her back. There's you alone and you can't manage. I had no idea there would be anybody who I could turn to. There came a point where I had to give her a bath. She shouted and said some not very nice words because I was undressing her and she did not want to get undressed. And if you've worked with anyone with dementia patients, I then became a dementia champion at the back of my mum's diagnosis. They have some real physical strength and you do not want to go head to head with a person with dementia. So I called a friend of mine who is a nurse and she said, I'll come and help you bathe her. I was so uncomfortable. I didn't want anyone to see my mum naked in a shower. Even I didn't want to see her, but it was the dignity aspect, which, because I know what my mum was like. She was a woman who covered herself. Now her daughter has to see her, whether she had that understanding or not. But it was things that mattered to me. As a Muslim woman, dignity is everything. Long story short, then Dad decided the better thing would be for me to keep her abroad. Everyone's working, it's very difficult. Same thing with Abu Bakr, you've said, is that we wouldn't even contemplate of thinking of putting mum in a care home. So the responsibility, some people will say culturally it lies with the son, some will say it's with the daughter, but for me, she raised me. My mother raised me, and it's our responsibility. So it doesn't, you know, whether it's son or daughter, and there is some cultural expectations for daughter-in-laws to look after the mother or father-in-law, and we definitely are not from that family, because we always say, well, actually, mum or dad did not raise the son or daughter-in-law, they raised us as children. So it's that kind of understanding that I want people to understand is, why don't Muslims, and I think that there is more people who are using care homes because things have become very different in the way that we operate. You know, we have 2 people now working, husband and wife both working to make ends meet. So there's lots of expectations now, and that really puts a burden on families because 30 years ago, you would have the husband who would go to work, the wife would stay at home, everyone looked after each other within the family. Those dynamics have changed now within our own communities. So I think there will be something around long-term planning, how we look after each other, our loved ones moving forward. Last year, September 2021, I received a call that your mother's died. And I think a little bit of shock, quite honestly. I just got up, picked up my passport. My brother sorted out everything, tickets. You need to get yourself to Heathrow Airport. You've got 4 hours. Our flight is going to leave in 4 hours. I live in Bradford. Heathrow's like, I said, I don't know how I'm going to manage it. I think it might be 4.5 hours. The journey was one of the most horrendous journeys because at the same time, he says, don't even bother driving down because there's protests on the M25 and you'll never make it. I think it was something rebellion who were protesting. So I managed to get to one of the trade stations from Bradford to Leeds, from Leeds to somewhere. And I think there was 5 trains in total. And I managed to get to Heathrow Airport, crying along the way. And I don't know how I boarded that flight, but I knew that God was not going to let me down. And I knew that in my heart. And all I wanted was just to sit at my mum's grave. And I got that. So when I go back and talk about what does caring mean, I would do it all over again. What support did I get? None. I didn't know where to go. And I wanted to talk about recommendations and what do they look like. Sorry. So some of the
It's okay, Shaheen. Do you need a minute?
No, I'll just give quick recommendations.
Okay.
I think one of the first things is managers need to be trained about supporting carers. So I've done a manager's guidance, and I'd like to thank Laura, because Laura is my colleague, and she's been putting a lot of stuff in the chat, and she's probably a to-go person at the minute. So as West Yorkshire Health and Care Partnership, we work across 5 places, and we've published a manager's guidance for anyone can pick that up and they can read it. At least they will know how to support their staff and to understand what working carers go through. The other one is, and I think lots of places have already have this, set up a carer support group if you haven't got one within your organisation. Organisations can learn from lived experience. Like today, I've learned so much from people, and perhaps people might be able to take something away from me. Organisations definitely sign up for the Carer Confident Accreditation Scheme. This will show that your organisation is invested in their staff. And there's something about personal responsibility. So we can't throw everything on an organisation. We have to take responsibility for our own health and talk to people who are going to support you. Take time out for your own self-care. What does that look like? Whether it means riding a bicycle, going for a walk, having a chat. And if need be, you need counselling or coaching, then honestly access that, because within our partnership website, we've got lots and lots of links. We need senior leadership buy-in from all organisations and champions to show that they actually do care and they want to do something around the whole carers agenda. And also, something that I've said time and time again, each time people talk about, and I think I've heard this coming across, people don't know where the services are, or they are so disconnected. We need to find a central hub and all those services listed, and I think it might be a job that it's for the partnership, or we commission it out or something that we bring around. These are all your services and leads which can help and support carers. If you need counselling, this is your counselling service. If you need respite, this is your respite. And that to happen across all 5 places, but in a one place, because if I am as a carer, I'm already, my mind is blown with caring, lack of sleep, with tiredness. I don't know where to reach out now. So that would be my recommendation, is to have a place so that we can find, whether it's the internet or whoever holds that information, click of a button, oh, I know exactly where I can go. So that would be mine. That's my recommendation. So thank you very much for listening. Any questions I'm happy to take.
Thank you, Shaheen. And I was really sorry to hear about your mum. And, you know, caring for somebody can be so overwhelming at times as well. We just don't understand the impact it has on not ourselves, but the person also being cared for, because it's something new for them and the extended family as well. John has put in the chat box that we're right behind you, Shaheen, and so has Laura. And it'd be really good if you could share the guidance with us that you've put together in the chat box. If you want to email it to us, what we'll do is I'll get Fatima to email it to all the participants that were here today. Does anybody have any questions for Shaheen? Jeff, I think you've got your hand up.
I was going to do quite a few things, so you very much did with what you were saying. The thing is, as you're saying, it's the support networks that are there. I mean, I work for Charities of Different Strokes, and we all support each other. And it's knowing how to treat with dementia. And now you learn, and the amount of times I've learned from other people about my stroke effects, but there's that support, is where to go. With my dad, I got refused support by Leeds carers because he lived miles away. He lived in Bridlington. he lives in Scarborough, but his doctors were in Bridlington. So there were like 3 counties, and I kept getting passed from one post to the other. So care comes in so many different ways. And what you were saying about the distances, I've recently found out my aunt's been doing the same thing with my grandma. I mean, to go over to Bridlington to look after. It's a bizarre situation for people to be put in, is that they're handling different lives and everything else. Do you think that social care should have supported a bit more, or did you have any care from other carers organisations or other dementia organisations?
Jeff, I think for me is perhaps if my manager had the information at the time, probably he would have been the only person to signpost me, but he had no idea about carers until quite recently that one of my ex-manager, who I'm no longer there, but he was also a carer himself. He did not know. I didn't know. I think the biggest thing is that we don't identify ourselves as carers. And because there's lack of identification, you're not going to. So I think
my role as a son, I had to look after him, and my friend with his role to support with my friend. He doesn't see himself as a carer. So the authorities seem to think, the police seem to think that I don't exist. I have to speak to him rather than speak to me. And so it comes in, it's that support. But on the manager front, you were lucky that you had a manager that probably could help if he did everything. Although I worked in care work, I did not have any managers that were sympathetic. And in fact, I lost jobs because I was too busy looking after my dad that I couldn't. And that's another thing, is that some people don't want to ask for help because it may mean that they lose their jobs as well.
Yeah, there is the fear of reprisal, and I think we've got people on here who are from a HR working within an organisation, and there's something around flexible working. For me, it wouldn't have worked, flexible working. I would have had to take annual leave because my mother, the kind of care she needed, and absolutely respect that. I can't expect my organisation to give me, but there's something around having some compassionate leave. Again, I wouldn't expect my organisation to give me 2 weeks of compassionate leave because my mother is still alive and providing some care. But, when my mother did die, they gave me compassionate leave. That was lovely, 5 days. And that was really kind of them. So I think it's about the understanding between your employer and an employee, and having something that Tony said right at the start is the two working together. And are your expectations real? Because we've got a job to do and we're getting paid to do a job. But equally, they've got to keep their staff healthy and happy within that environment. So there's a duty, I suppose, in both parties to make sure that that balance is correct. And I suppose from a partnership point of view, we are looking at ways to making sure that whatever services are out there, they are compatible, everyone gets the same. So we know that Leeds are doing some fantastic things. We know that Bradford is, or Wakefield, but we hopefully are trying to get it across that it's a seamless service so people are not struggling. And again, if we don't identify as carers, that is the first sticking point.
Thank you, Shaheen. Thank you, Jeff. Khalda, you've got a question for Shaheen?
It's not so much a question, but I think, Shaheen, lovely to see you, by the way. You raised a very important point about your journey in this process and the fact that you had to travel abroad. And it was just really a point that I'd really like noting about understanding that we have and we employ a lot of people whose caring responsibilities do span geographical boundaries, whether it's they need to visit a relative because they're ill or because they're in their final stages and they want to go and pay their respects and be there for the funeral. But international travel takes some arranging and a considerable amount of time that is more than if you were traveling to another city in the UK. And I just think that, in terms of the cultural needs of our communities who are employed by, whether it's Wakefield, Leeds, Bradford, or another area, that that is a really important consideration. And sometimes within that, we're not saying you need to then give these people more paid leave, but there might be other considerations that need to be taken into account. And I think Shaheen's story really very eloquently tells us what that's about.
Thank you, Halda. There was another thing, but because it didn't quite fit within the carers, it was about end of life and burial, especially from a Muslim perspective. So I no longer am a chaplain at the hospital, but I still get called on a weekend. We can't get the release of the body and it causes anxiety. But on one hand, we talk about personalized care. What does that look like? What does good end of life care look like? You know, and all these things will at some point, if you are a carer, you're going to start looking at planning those things. And if we are looking at, this is what it looks like, and this is how my needs, I would like them to be met, but it doesn't happen, and because we're still getting those same problems again and again. And again, what happens in Bradford doesn't reflect what's happening in Colesdale perhaps, or somewhere else. So I suppose that's a discussion for a different day, but these are things we need to look at. Contingency planning, for instance. So I think Plan B, did Meg mention something about Plan B? We don't think about the worst. What if the worst happens? So what if the carer falls ill for the cared person? What happens then? So we've done, thank you, Huma. You guys have done an absolutely fantastic job in doing videos in numerous languages. There will be, I think somebody might be putting up a link, hopefully in the chat bar. Definitely worth to watch. They're not very long, few minutes each, but they're fantastic in terms of contingency planning. Plan B, what does that look like? You know, like for instance, message in a bottle. So if you was to ring 999, paramedics come out, they could go straight to the fridge, and they've got a bottle in the fridge and it tells you the cared for person's all their medical information in one place, so it saves time. And that contingency plan is about saving lives and saving time. So is there anything else you want to add to that, Huma? Because you guys have done...
I will do, but I think Javad wanted to come in and ask you a question, and then I will talk a little bit about message in the bottle.
I think it's not a question as such, but I think Shaheen raised a really important point about what happens when there's a death in the family. So culturally, I mean, I'm talking about, you know, Indian subcontinent culture here, but it might be different for people from different parts of the planet. We need to kind of incorporate that. We need to start discussions around what happens around that, because any organization that has a bereavement kind of leave, there's specific kind of boundaries around that and conditions on that. So it doesn't take account of everybody's culture. So I'd just like to recount a discussion that I had with my manager a long time ago. Somebody passed away in the wider family, and I had to go and pay my respect. I not had to, I wanted to, I was compelled to go and pay my respects. And my manager was kind of saying to me, how do you feel and how are you? And I said to her, I am fine, because so I kind of operate in a culture that has predefined roles and very structured ways in which people take on different roles when they, so you know exactly what to do. It's not my mental health, it's just I need the time off to be able to go and fulfill those kind of duties that I have. So it's not just about when somebody passes away, but kind of we need to recognize that the way that we propagate our culture is by being part of it. So when there's a death, when somebody passes away, when somebody's ill, we are compelled to go and find out how. And so that plays a social role in our society. So that kind of needs to be incorporated. So without kind of focusing on that too much, I think that along with talking about carers, we need to be starting to talk about that as well, talking about bereavement and death and how we deal with that in our, you know, in terms of people's responsibility to work and how organizations can start to kind of learn about that as well.
Jawad, if you want to connect with me afterwards, or if there's anyone else who wants to connect with me and look at the pathway, because we have got a pathway for end of life, and actually that end of life sits within our portfolio of long-term conditions and personalization. More than happy to work with people on what do we have current procedures and policies in place, and especially around the release of bodies and weekend, you know, if there's a post-mortem, you know, and how does that affect people? And if it's a straightforward death, you know, because I know that there's lots of discrepancies at the moment within that on weekends, especially out of hours. More than happy to work with people on that, because I think there needs to be something done about this now across our 5 places.
Thank you, Shaheen.
Definitely.
Thank you. Meg just put, it's important to have transparent policies and guidance for staff. Anita has said it's sad we're in 2022 and there is no dedicated support and training for unpaid carers, family members or friends, and poor carers are fumbling around to find support agencies to support them. So it looks like there's some need for training here. And John said, thank you, Team Wren, Laura at West Yorkshire Healthcare Partnership. We need more of this dialogue, more awareness raising of the challenges and consistency of approaches across the 5 places. And we have, like Shaheen was saying, that we have, Race Equality Network have produced some videos in various languages around the Message in the Bottle campaign. We were going to show that, but we're having a bit of technical issues because there's no volume, but Fatima will put the link in the chat box, and that is all around contingency planning. What happens when the paramedics turn up to your door? You know, how would they know where to find the information for your loved one, about their medication, you know, who the emergency contact person is, you know, what they need to do in case of an emergency. So yeah, please make sure that you do check them videos out. They will be on the Wren YouTube channel as well, and up on the West Yorkshire Healthcare Partnership website, and all the links will be in the chat box. But Fatima, at the end of this session, will be emailing you everything that we've you know, discussed, especially the links and the messages, message in the bottle video links as well. Does anybody have any other questions? Shaheen, do you want to just do a closing about what West Yorkshire Healthcare Partnership are doing? From me, it's thank you everybody, especially to our panel members, for sharing their personal experiences and their journeys about being a working carer, sharing their working responsibilities and dedicating themselves to their work as well. It's not an easy role, which we often take for granted. You know, I have been in situations previously myself in, you know, other work where I've not had time off to care for my mum, and it's just been a real struggle. But, you know, this role is quite flexible, which I can accommodate my mum with her appointments. So it's been fantastic to hear from everybody. So thank you so much. And I'll just pass over to Shaheen to do the closing. And we do have a couple more webinars this week. On Wednesday, we've got one for the VC healthcare webinars dedicated to the unpaid working carers for the voluntary and community sector. And then on Thursday, we have unpaid carers webinar for the NHS and health and wellbeing settings. So the details will be up in the chat box. So if you could pass the details on to your colleagues who might want to attend. So thank you. Shaheen.
So, thank you, Huma. And this is a real quick reflection. As much as it was being organised as a webinar and we've had guest speakers, but it seems to me, and the way that I felt is it was perhaps because the numbers were low and people have been able to share their intimate experiences, and it seems like it was done in such a way, and I think that was really, that kind of thing brings about a lot of learning, that people have felt confident enough to either share it in the chat or comment online. And we've heard more stories, I suppose, than only the 2 or 3 that we've, you know, were supposed to hear. So I think that's the first thing I'd like to thank everyone for sharing their person, because it's not easy. You can see that I still tear up and I still get emotional, and this is why I don't particularly like to share. But when it comes to the wider learning and for organisations to reflect and think how they can do things, I think that's you know, the bigger picture and the bigger benefit, you know, for others. That's the reason why I sort of volunteered to do this. I think I just want to finish off by saying that first of all, thank you for all of your time. It's not easy to get 2 hours out of a busy working schedule. I understand and appreciate that. And also, I would like to thank Laura and the whole of the Wren team for pulling this together. And again, like I said, if there's anything that anyone thinks they want to have a chat outside of this, please feel free to get in touch with Wren, or perhaps if you want to get in touch with me, especially around the end of life, more than happy to work with people. So thank you very much.
Thank you, Shaheen. And there's also the unpaid carers steering group as well. Laura put details. She mentioned that in the chat. So if anybody wants to, you know, join that steering group, is there an opportunity for them to do so, Laura?
Hi. No, not directly.
Okay.
However, that's just a place that we get all the unpaid carers commissioning leads together to make sure that everyone's kind of singing from the same hymn sheet. So Tony Sheik comes to there, and Dawn that was here earlier, I don't know if she still is for Calderdale, but just to reassure everyone, the themes of things that we've heard today aren't new. It's the things that we are totally committed to working on. And yeah, there's lots of information through those links. So just take your time and have a look through those and contact me and Shaheen if we can be of any other support. But yeah, just to reassure you that within West Yorkshire, there is a steering group that all these themes come to, and we try and, you know, figure out the best steps of how we can keep supporting people. Thank you, everyone.
Thank you, Laura and Shaheen, to Khalda, Jawad, Tony, and to all that participated in today's conversation. I hope you found it useful, and it has been a bit of a, you know, peer mentoring session, hasn't it? You know, we've got to talk about our experiences, which has been good. So yeah, let's keep the conversation going, and it's been lovely to see you all, and do keep a lookout on West Yorkshire Healthcare Partnerships website for more details. Thank you so much.